There you go. I think we are.
Yep.
We're good.
Okay.
Yes. Excellent. Well, hello and welcome. We're so glad that you are able to join us. We have Kina and soon to be Lauren from the R. Adams Cowley Shock Trauma Center. They're going to give us some really great important tips and tidbits on fall prevention. So without further ado, please, Kina, take it away.
Sorry. Can you hear me? I froze for a second. I just want to make sure we're okay.
We are good.
Yep, I
Okay,
got you
perfect.
fine, Kana.
All right, great. So my name is Kana. I am a physical therapist by background, and my colleague Lauren is on here as well, and she is a community health specialist with a background in public health. And so we are a part of the Shock Trauma Center for Injury Prevention and Policy, where we focus on fall prevention and even older driver safety. As just one of the programs that I manage. We also have programs for teens and different things like shallow diving and carbon monoxide safety, kind of all the things that we see at the hospital and things that are preventable. And so falls actually, what's up? Can you hear me?
Yes.
Okay,
Yes, we
sorry.
can hear you. We're just getting someone else's background. So if you could mute yourself, you're more than welcome to keep your camera on, but if you would mute yourself, that'd be great.
I got a
You,
question. We have the ThinkFirst Prevent Falls Shock Trauma logo on the front. I can't get out of it.
Yeah, I haven't moved on yet.
Oh, okay.
I'm
All
just giving
right.
you my background. Yeah.
Okay.
Yeah, so that's kind of what we do. Our job is to kind of go out to the community and talk about ways that we can prevent you from coming to shock trauma in the first place, right? Um, so we do have a pre-class survey. So if you're able, you can just see if you can scan it with your phone. If you just hold up your camera
Oh,
to
I
it,
have a
a
phone.
link should pop up, and I can give a couple minutes for folks to work on that.
Yeah, grab my phone, Sean.
I don't have
Is
a
it pulling up for
smartphone.
everybody?
it is. And Joanne,
I
I'm
don't
just
have
going
a
to mute you,
smartphone, so
okay?
I can't do that.
What's that?
Can you go ahead
I
and
said,
mute yourself, Joanne?
Mm-hmm.
Thank you.
no, I said I don't have a smartphone, so I can't do that survey.
Okay, if you're not able to, that's totally fine. But if you're able to, we'd appreciate it. We use these surveys to kind of improve our programs and kind of get that feedback to make sure that we are providing good information. So I'm going to move on. We have a short little video about shock trauma. So I'll just play that for you.
There's no audio. You didn't share your audio, I
Oh,
don't think.
oh, sorry.
There's a helicopter landing now.
Yeah. How do I, it's in the PowerPoint, so how do I share that?
When you share the
Um,
screen, there's also, I would stop sharing, then start sharing. It'll ask you, do you want to share your audio as well?
Sorry about that. Okay.
So when you do share on the right-hand
Yeah,
side,
I
it
see
also
it.
says
Yeah,
share
sorry.
sound. That's okay.
Gotcha. Sorry, I missed that part earlier. Okay, let's try that again.
You got it now.
All right, good.
In your darkest hour,
Oh, oh boy. We're all having issues today, huh?
in your darkest hour, we are the light. The world's first and only integrated trauma hospital. We are Shock Trauma. We are pioneers of trauma care, treating your loved one in the first hour after injury, turning that golden hour into a second chance for more than 7,000 patients last year.
Everybody puts the pink scrubs on really for the same reason, as a singular mission, the care of injured patients.
We are healers, treating the sickest of the sick, with critical injuries from vehicle crashes, falls, and violence. Our save rate is an astounding 96%.
We have the best trauma system in the world. We have the best trauma doctors, the best surgeons, the best nurses. And, I know because Maryland Shock Trauma saved my life or I wouldn't be here today.
We are the best of the best, 934 strong, but always better together with one unified mission to save lives.
We're here to serve anybody who is in need of treatment for critical illness and injury. And so we not only see it our mission as to treat patients here at the Shock Trauma Center, but to teach others what we know.
We are protectors, preventing injury through 398 events last year, educating more than 24,000 people.
When you're us, you have a moral and ethical obligation to share. It is our job to teach, and it's our job to discover. If we don't do it, who will?
We are a gift from the state of Maryland to the state of Maryland and to the world.
I think it ought to be a gift to the world. As long as I'm around, we're going to keep looking to give.
Toda shock trauma.
Amasaganaloin shock trauma.
Shock trauma, 감사합니다.
धन्यवाद और शुक्रिया Shock Trauma Center.
谢谢 Shock Trauma.
Gracias Shock Trauma. Aba Shock Trauma.
Gracias Shock Trauma.
Grazie tanto, Shock Trauma.
Thank you, Shock Trauma.
We are Shock Trauma.
All right. So does everyone know a little bit about shock trauma, or hopefully have not been there as patients? Can anyone guess what our highest reason for admissions is to shock trauma?
Falls?
Yeah, you got it.
Oh, I was hoping that wasn't the answer.
Yeah, sorry, but unfortunately it is. Most people think it's, those motor vehicle crashes and violence. You hear on the news about gunshot wounds and all those types of things. But actually falls is the number one at 42%. Close second is motor vehicle crashes, and that includes pedestrians and motorcycles and things like that. And that's at 37%. And then violence is about 18%. So even though we see that more on TV, it's really not a huge part of what we see. And just to kind of go over what that video was talking about is the Shock Trauma Center was created by R. Adams Cowley after World War II. He was a surgeon out there in the field, and he realized that the faster you can get to patients, the better results you can have, which makes sense, right? And so when he came back, he got a government grant and was able to, start research and figuring out how to give the best trauma care. And so he worked with our state troopers, and we have now 7 helicopters that work to help bring patients to the hospital so that they can get that care within that 60 minutes. So even, normally if you go out to, Ocean City, it's maybe a 3-hour drive, right? But if something unfortunately happens, they can get you to shock trauma in less than 30 minutes. Same thing if you're out in Garrett County and Deep Creek, it takes about 40 minutes. And of course, that's why we have such a high save rate at 96%, because we really want to make sure that we're getting to patients so that we can take care of them quickly. And something that is nice for Maryland is if you pay your vehicle registration fees, hopefully you won't, but if you needed the helicopter service from the state trooper, it would be completely free. So those costs can get pretty high because they can give you treatment in the helicopter. There's 2 flight medics and 2 pilots. So the flight medics are able to give blood and put you on a breathing machine and do all the things that they need to get that care started early. So yeah, it's kind of a nice thing that we have that as an insurance policy if we ever were to need that. And so we're going to talk about falls and kind of understand why it's so important and what serious things can result. And also just make sure that we understand how you can reduce those risks. Just some facts here. More than 1/3 of people 65 and older fall every year. And 2/3 of those fall within 6 months. So once you fall, there's a much higher chance for you to fall again. And most likely there's probably some underlying issues, and that's why. They're also the leading cause of both fatal and non-fatal injuries. It only takes once sometimes. We've had colleagues and people that have shared that, their parent or loved one fell and, it was fatal. So it's really important, and not to scare anybody, but we just want to make sure that people are aware of this and how serious it is, because I think there's always in that mindset that, it's never going to happen to me, right? I'm doing well. I'm moving around okay. And so we just want to bring some awareness to that. So, with all that said, I just want to make sure that you understand that falls are not an inevitable part of growing older. It is something that we can prevent, and be more aware of so that it doesn't happen. So we're going to talk about fear of falling. Anyone here ever experienced a fall?
Oh, yeah.
Yeah. Did it make you feel nervous afterwards to do those activities? Yeah, and that's
it was totally unpredictable. I don't know why I fell to this day. I just lost my balance.
Yeah, and that happens all the time. And we hear that all the time too. They're like, oh, I was doing fine, and all of a sudden I just fell. And sometimes that can cause this cycle of falling where you're scared of falling. So you develop a fear because you've experienced it, you know how shocking it is. And then you start reducing your activity, right? So you might start reducing your activity where you may not go out to the store, you may not do that thing that caused that fall, right? And then that reduces your mobility. So you're not moving around as much, you're not as physically fit anymore. And then that also leads to isolation, right? Because now you're not going out as much, you're not doing the things. And that also affects your mental health. And so it's important that we break this cycle and make sure that we are not, letting that fear of falling really guide us in our decisions, and that we are fighting against it and doing everything we can to prevent it from happening. So some common risk factors. Anyone have any ideas of what a risk factor could be?
How about medicine?
Besides age?
Patients, yeah. So I'm going to pull up some here. So unsafe home and outdoor environments, right? If we have, we'll go into more details about that. Vision impairments, poor nutrition, lack of muscle strength, and then medications. So we're going to go through each one. We're going to start off with home safety. So these are all, the areas in our home. Where do you think is the most common places that we find people fall?
Bathroom.
What's that?
The bathroom.
The bathroom, yes. The bathroom and the kitchen are usually the highest places where we see people fall. Sometimes the bedroom, especially at nighttime, if people are getting up to go to the bathroom. So it's important to be aware of these things and keep ourselves safe. So generally, we always recommend that you carry a phone with you, whether it's in your pocket or if you have one of those carriers like pictured. Avoid any sort of tripping hazards, right? If you have cords and cables or lots of furniture around, that can really cause lots of hazards. As well as clutter and throw rugs is a big one. I know it's beautiful, it makes your house look wonderful, but over time they can fray or wear down. They can also start curling up at the edges, so your foot can get caught, or if you're using a walker or a cane, that can get caught. So we really want to make sure that we are securing them down or removing them altogether if we can. Of course, lighting is important, right? If you're not having adequate lighting, you can see in the hallway, it's much harder to navigate that space. And then, of course, if you can have a emergency response system where you have a pendant or a watch or something, that's always helpful, of course, as well. So in the kitchen, we want to make sure that we're keeping things that we use often within reach. We're not, trying to climb up onto chairs, because we've had patients in the hospital say that. And then they fall, right? And so if you are needing to climb up, you want to make sure you're using a proper stool with rubber handles, with rubber bottoms and a handle. And that if you're keeping items within reach, it makes it easier, right? You don't have to be able to reach up higher over your head if you can place them in the cabinets below.
Counselor, and I have just a general question. I'm online trying to book a cruise, and it's taken me, because I signed in on
Latoya,
account
we
number.
hear you.
It has all my
Latoya,
information, and
can
it's
you
taken
mute
me all
her?
the way to the payment
I'm not
page
the
to
host.
pay. But it never asks, and it's for one room, 2 guests.
Sorry, y'all.
It's never asked for the other person's name. Do I put that in after I pay for it?
If you go to Latoya.
Yeah. Oh, I see. Okay, gotcha. Sorry.
Thank you. Whew.
All right,
All
sorry.
right. No, thank you.
Okay, so yeah, so you want to make sure that everything's within reach. So if you can reach, put things reorganized, so you can put the things you use commonly, on the lower shelving or even on the counter. It'll just make things so much easier for you. Or using a grabber or reacher that's pictured in the first one is important too, so that way you're not, having to climb up on things to create a risk there. Of course, we want to make sure that if you are cooking and you're needing to carry large parts of water, that you are maybe sliding it instead of carrying it. Sometimes you're carrying it, you don't realize if you're, trip on something or lose your balance and a little bit of water spills, then that's, another slip hazard right there as well. Of course, using non-slip mats to make sure that it's not moving around. Because the kitchen and the water are the places where we have water, and that's obviously already going to increase our risk of falls there. The next is the bathroom. Again, making sure that we're using non-slip mats. You can even use them inside the tub to make sure that you're not slippery. You want to make sure you're mounting your grab bars. We often have patients that come in with those suction type ones. And I know they're easy to install and convenient, but oftentimes, I've had patients say, oh, I went to reach for it, and it just came right off the wall. And so then it made them fall, even though they were trying to keep themselves from falling. So really having them actually installed by a professional is really the best option. And there are tons of resources in Maryland that can help you get that service done either free of charge or at low costs. Also, having a handheld shower can be helpful if you're having a tough time reaching behind. So just to make sure that you're getting clean and getting all the areas you need to. Of course, using a tub bench that's pictured where half the bench is outside of the tub and half is inside is helpful because you can just sit, slide yourself over and bring your legs over. You can use your hands to bring your legs over just to make sure that you're being safe doing that. And they also make stools and different types. So it all depends on your bathroom and what works for that space. So there are some common tools and aids that are helpful. Sometimes, it might be hard to reach behind and make sure that you're fully clean. So there are toilet aids that help with wiping, and there's all sorts of different ones that you can use. There's also incontinence aids, using briefs or pads or even a bedside urinal can help. If that's something that's an issue for you. But the main thing is making sure that you are changing them frequently. Just because if you're not having sensation or you're not sure if you have, had a leak, you don't want that sitting on your skin because then you have a chance for infection, but also skin breakdown, and that can be painful and can take time to heal. So we really want to prevent that from happening. Also, there's skin integrity aids. So if you're having a hard time reaching down to get those toes, they make long-handled sponges. They also have mirrors that can help you check your skin. So if you have something like diabetes or any sort of other condition that reduces your sensation, you may not know that you have a little nick on the bottom of your foot, and then eventually it becomes more and more, and then it can become a big problem. So we really want to make sure that we're inspecting our skin in places we can't really see readily. And then taking care of that if we do suspect anything happening. And then there's dressing aids. So if you're having trouble putting on your socks, there's a sock aid. You basically put the sock on it's like a round kind of cup-like shape, and you put the sock up there. You slide your foot in and pull, and that gets your sock on. Very easy to use, and they have different sizes too available. So if you have like a wider foot, they make them a little wider. They also have dressing sticks, so if you're having trouble reaching behind, that helps, as well as long-handled shoe horns. So there's lots of different types of equipment out there that can help and just make things a little bit easier. I mentioned the bedroom being in place, especially at nighttime. So we highly recommend having night lights. They even have motion sensor ones now. So if you don't want it on all the time, that could be a nice alternative. Or even keeping a flashlight by your bedside. So when you do wake up, you're able to grab it, turn the lights on, turn the flashlight on, and be able to walk safely to the bathroom. Another important factor is when you're getting up, you want to make sure that you're pausing. What happens is you're waking up, your body needs time to adjust, wake up. Your blood pressure might need time to adjust as well. So making sure that you're pausing, we usually say if you can do like 10 Mississippis, nice and slow, that should be good. Even if you can wait a full minute, that would be even better, especially if you have blood pressure issues or orthostatic hypotension. You want to make sure that you're wearing closed back slippers. I know it's so much easier to just slide your foot in to slides or something that doesn't have a back. However, we really want our feet to be supported, and so it's important to have that full support all the way around. And you want to make sure that there's a backing and that the grips on the bottom of the shoes are not worn down. Because oftentimes people have, nice slippers like this, but then they've been wearing it for so long, the bottom grips have now, worn down and they're not providing the grip that they really need to keep safe. Stairs are probably the fourth reason where people, where they fall most often. If you have carpeting or rugs or like a runner on the stairs, again, beautiful, but it can really be a huge risk over time. Those carpet fibers and rugs, they start wearing down, they start getting slippery. So it's really important that we're either replacing them or making sure that we're being mindful. You want to also, if you can, put in these stair treads. Now, again, they're not doesn't look as nice as like a pretty rug, but this provides some grip and it also provides some depth perception. So if you're having vision issues, you're not able to tell where to put your foot. If everything is all one color like this, it can be difficult to see where to place your foot. So having some color contrast like this, that's pretty stark, is helpful. And of course, we want to make sure that we're using handrails, having handrails on both sides like this, if it's possible. And then also making sure we're keeping our hands free, right? So using a shoulder bag or a backpack if we need to carry items from upstairs to downstairs or vice versa. If you're doing laundry, taking a little bit up at a time and not taking the whole basket. I recently had a patient that said that they were carrying the laundry basket down and they just miscounted their steps and they weren't paying attention and they missed a whole step and then they just kind of slid down and then the laundry was everywhere anyway and probably had to be redone. So it's not worth it. Just take your time with it, do multiple trips or have someone else help you just to make sure that you're okay. And if you do need to do it, count the steps. If okay, I have 10 steps, you're going to pay attention and be aware while you're doing this so you can count out loud or count to yourself to make sure you're catching all of those steps. So we're going to talk a little bit about safety outside the home. Ramps, if you need to get one installed, you want to make sure there's less than a 5-degree angle. Anything higher than that can be really difficult to navigate. You want to make sure you're using handrails if they're available. And if not, if you just have steps and no rails, it's highly recommended to get a handrail placed in there just for safety. You want to also make sure if there's areas where it's very slippery for you, that you're using non-skid deck paint. I know some parking garages down in Baltimore have that. The one I park in for work has that, and so every time you're turning, the tires kind of screech because they're slowing it down. So it's a way to make things a little bit more safe outside for you as well. Anyone here like to garden?
Oh yeah.
Yeah. Do you use a garden kneeler?
No, I don't have one.
It's okay if you don't, but it is a nice little tool here that can be helpful, just to keep you safe and sturdy, and also can provide, some storage for your tools to make things a little bit easier. Of course, when we're walking outside, the grass is not going to be nice and even like our flooring at home or like in a building. So you want to make sure that you are wearing proper shoes. Sometimes it's easy to say, oh, I'm going to just throw on some slippers or some sandals and run outside to get the mail or whatever it may be. And you want to just make sure that you're being safe because sometimes there's like a little groove or divot and you may miss it. Or it might trip you up. So you really want to be really conscious about the footwear that you're using, especially when you're going outside. And of course, using supplies, using your assistive device if you use one, just to make sure that you are as safe as you can be. If you're on the street, if you're going for a walk or you're, in the outside crossing the road, making sure that you're scanning, you're using crosswalks and especially now as it's going to start getting, darker earlier, unfortunately. We want to make sure we're wearing reflective wear or use a flashlight so that people can see you, especially if you're in a parking lot, trying to park in a well-lit area so that, you can be seen and people know where you are, and then you can also see as well. If you are crossing the road and you see that the light is about to change, maybe at like 10 seconds, and you're like, I can make it, it's really best if you wait and give yourself enough time to cross. Sometimes you're rushing and you may trip, and that can cause a fall in itself. So it's better just to kind of wait, take your time. And also being cautious of drivers. Sometimes people are running lights and doing crazy things. So you want to make sure you're keeping an eye out to be safe. So we're going to talk a little bit about vision and how it relates to falls. So some common eye disorders that we see are age-related macular degeneration and all these others listed. You can see that there's an image here that kind of shows what it might look like if you had one of these things. Of course, no one can really know, right? Unless you have it yourself. And so you can kind of see just from the pictures that, there's gonna be some deficit. Like this doesn't look too bad, but it's still not very clear. So if there's minor details that you might miss, can cause a fall as well. So if you're having that one, staircase with all the same color carpeting and everything's the same color, it's going to be hard to navigate when you have vision issues. So the main thing you want to do is make sure you have proper lighting first and foremost, that you use large print wherever you can, or use a magnifying glass if you need to, and then use contrasting colors like we talked about for the stairs, and then making sure you stay up with your eye doctor to get your prescriptions updated as needed. If vision is an issue, if you visit seniorliving.org, they have lots of great resources on different programs that you can use. But even our cell phones have different options for accessibility. No matter, if you have Android or Apple, it doesn't really matter. There's always some sort of option to either improve the, enlarge the text size, or even there's even talkback features. So if you wanted to read it out to you. So there's lots of different technology that can be helpful. There's some more apps here that can be used. So Be My Eyes is where someone that can see volunteers, and you receive live video from them, and they basically use your phone camera to look around to help you navigate the environment. So if someone has like low vision or something that can be hard to navigate, that can be a really helpful thing. And there's different programs for different types of phones as well. So it's really important to just, seek out what there is. Some of them are free, some of them you have to pay for. So it really depends on what type of help you need and how much you need. All right, so we're going to talk a little bit about nutrition, right? Because we talked about how important that is to prevent falls. So eating healthy can be important because we want to make sure we feel better, right? We have that energy to do all the things we need to do, right? We might have to do the laundry and cook and, go to the grocery store. And we want to make sure we have that energy to be able to do all those things safely. It also helps us maintain a healthy weight. The more weight we have on, that's not, good for our joints and our bones. It puts more pressure, which can cause more breakdown. And then, of course, it reduces your risk of chronic diseases as well. So some things that poor nutrition can lead to are frailness and falling in itself, right? If you don't have good muscle strength, bone health, that can cause you to fall in itself. It also might take longer to recover from an injury. So if you've had a fall and you're not eating properly, you're not getting the protein and calcium and all the things that you need to heal, it's going to take a lot longer to recover. Even something simple like having a cold or flu, if you're not getting the nutrients you need, it's going to take a lot longer to recover. And of course, if you have a wound, it's not going to heal as quickly, and there might be more issues with that. And more to this, we want to make sure that we are getting adequate calcium and vitamin D to help with bone health. There's much higher risk of hip fractures in older adults, and sometimes they can be fatal. So we really want to make sure that we are protecting our bones and keeping them safe, asking for those osteoporosis screens, especially if you're a woman. After menopause, your estrogen levels decrease, and that is an important hormone that helps with bone health. And so that's why women tend to be at a higher risk. And then, of course, weight-bearing exercises can help. So what are weight-bearing exercises? Could be walking, could be climbing stairs, could be strength training, like doing squats, like, getting up from the chair and standing up and then sitting down during commercial breaks. If you're watching TV, you can do that. And using weights, right? And weights doesn't have to be, like those big guys in the gym, you're not pumping iron like that, but it could be a couple pounds, right? It can be 3 pounds, 5 pounds, depending on where you're at. And you can always increase it as you keep doing it, so that you're challenging your bones and your muscles to grow and to continue to develop. So some more tips for eating healthy. We want to make sure we're drinking plenty of liquids. Oftentimes as we age, we have a decreased sense of thirst. And so we want to make sure that we are getting enough hydration and that our muscles or joints, everything is getting everything that it needs, because dehydration in itself is actually a cause for falls too. We have patients that really, that's the only issue, that was the only reason why they fell, is because they were just dehydrated. So it's really important to stay hydrated. You want to make sure that you are varying your vegetables, right? And if, sometimes I know it can be hard, you get a vegetable and it's too much and you don't want it to go bad or waste it. So using frozen options or canned options are just as healthy. With canned options, you just want to make sure, if you have sodium restrictions from your diet, from your doctor, if you have certain conditions, that you're rinsing the vegetables so that you're kind of taking away that sodium there. And then, of course, talking to your doctor, right? There's so many things out there about different vitamins and supplements, and if you take this is going to help. It's really good to consult with your doctor, and they might refer you to a dietitian to work with them to really understand what you need, because sometimes you might take something that doesn't work for you, or that might interact with your medications, or that you're getting too much of it. So it's really important to make sure that you're being safe with taking whatever it is you're putting in your body. There's also lots of resources for nutrition, so you can visit myplate.gov, and there's even a calculator where you can go and kind of put in all of, your information, and it will guide you on how many calories to have and like kind of how your plate should look. And there's also resources, if you dial 211, they can tell you about different things in your area. Each county has their own different programs, so it's important to kind of figure out what's going around in your area. Of course, the Council on Aging is a great resource where they have so many different options and availabilities. So using those things can be helpful to make sure that you're getting all that nutrition that you need. So now we're going to talk about exercise, right? We talked about lack of muscle strength being a risk factor. So we're going to talk about why it's so important. We want to make sure that we are exercising to improve our coordination, our flexibility, our balance. It can even help us regulate our blood pressure, blood sugar, our sensory input. And of course, it can help our mental health as well, right? Moving around, being active for longer can make you feel good about yourself, makes you feel like you're able to do things and you're not, losing out on the things that you used to do. Of course, you want to make sure before you begin any sort of exercise, especially if it's something new to you, that you're consulting with your physician and making sure that it's okay to do. You also want to make sure that you're staying within your own fitness level. Oftentimes we see patients that, like, oh, well, I want to add more weight, or I want to do this, and that's great. But that old adage of pain is pain, you need to have pain to gain muscle strength is not really accurate at all. We want to make sure that you're not in pain and you're not having difficulty doing the exercises, because it's really a lot about the form. And if you're not having that proper form, then it's not really going to be doing much for you. So we want to make sure that we are, consulting with a physical therapist or an athletic trainer, or joining a class where someone's monitoring you if you're not really sure where to begin. And a lot of the senior centers offer lots of classes, which is really nice. If you're not able to get out, there are tons of free virtual classes. AARP has videos that are free online that they post at this website. They also on YouTube, you can go to the National Institute of Aging. It's a program called Go for Life. They're a little bit older videos, but same exercises still work. There's also a program called Silver Sneakers that you can do. And then there's also other options out there where you can follow physical therapists that do seated exercises, or even, hospital systems. So it's really, there's a lot of resources out there. And this is a nice option, especially as winter is approaching, where, if you don't feel like going outside, or if it's snowy or bad weather, you can, do these things at home.
Okay, now
So yeah,
a plug too for Opal
yeah,
because we are virtual. So,
yeah, exactly.
yeah, lots of classes that we do on
Yeah,
strength fitness. A lot of our exercises classes are actually evidence-based, which means we take
nice.
you baseline first and then measure you just to make sure that you've improved or
Great.
that's always the thing.
Yeah, absolutely. And like I said, each uh senior center has kind of their own different things, so that's great. I think the virtual option is really helpful, because like I said, sometimes you just don't feel like going out or the weather's bad, and this way you can still get that important exercise in. So we're going to talk a little bit about medications. Again, I am not a physician, so I'm not telling you to change anything about your medications or stop taking anything. This is just kind of informational for you. Does anyone take any of these medications?
Oh, yeah.
Or at least one of them? Yeah.
Yes.
So, something called polypharmacy. So, if you take more than 4 medications, particularly these are the common ones that are related to falls, there's a much higher risk of falling, because of the side effects that they can produce. So, it's really important that we are understanding the medications we're taking. I've had patients say, "Oh, I've been taking this for the last like 20 years." I'm like, "Okay, well, why are you taking it?" And they're like, "I don't know. My doctor told me to take it." And that's great that you have trust in your doctor, but you also want to make sure that you understand your own medical health and figuring out why you're taking it. Oftentimes there's like medications, and you might not need all of those things, so you really want to make sure that you're understanding your health and why you're taking it, what you're taking. Sometimes medications can cause you to feel dizzy or lightheaded. And so we go back to that 10-second, 10 Mississippi's, a 10-second rule, before you stand up or before you get up from bed, just to make sure that you are not getting dizzy or lightheaded, particularly if you're taking blood pressure medications. This can be a big cause of feeling that way. So giving your body some time to adjust and rest is helpful. I'm going to go back to talking about hydration. Drinking plenty of water is really, really important. If you are dehydrated, again, this can cause you to be lightheaded and then fall. Of course, steadying yourself, so using that cane properly. Oftentimes I see patients with the cane like up in the air or it's on their elbows and they're not really using it the way it's meant to be used. Or like because they see that there's a handrail, they don't stop using the cane. But we really want to make sure that we are using our assistive devices properly. And then, of course, exercise, right? We just talked about how important it is, whether you're walking as your exercise or you're exercising while you're sitting. If you're sitting watching TV, there's tons of different exercises you can do, just to keep yourself safe. If you're cooking, you're waiting for that water to boil, you can be at your kitchen counter and doing exercises there too. So you kind of work it into your routine. It doesn't have to be a whole planned out thing of, I have to go to the gym or I have to do something like that. It can be just something simple that you add into your routine. Maybe you park a little bit further at the grocery store, so you can get a little bit extra steps in. If you are on blood thinners, it's particularly important to make sure that you are, if you do fall, that you are notifying somebody, because you may not see blood, and you might feel like, okay, I'm okay, but there might be internal bleeding happening. And so we want to make sure you're getting the proper care for that before it becomes, a big issue. If you might also feel dizzy or lightheaded, you want to make sure if that happens, you sit and rest and get into a safe position, so that your body can recover. Over-the-counter drugs can also have some implications, right? So there's side effects. There's certain ways you have to take them, right? If you're taking a NyQuil, you want to make sure you're not driving, right? And you want to make sure that you are taking it at nighttime. So you want to make sure you're checking your labels and you're taking them as ordered, as instructed. Even if it says take with a full meal, you want to make sure you're taking it with a full meal and not just having a snack and taking it. These labels are there to kind of guide you and helps how the medicine works. And so sometimes if you're not taking it the way it's intended, it may not absorb properly and it may not work. And so then it can cause other side effects or other issues. So you want to make sure you're playing it safe and, keeping with whatever is told to you. And if you're not sure, ask, right? Ask your doctor, ask your pharmacist, go up to that consultation window and ask them and say, hey, my doctor just started this new medication. What should I expect? And yes, they give you a whole printout, but I don't know about you, but it's so tiny, it's so hard to read. So it's really important that you just have that conversation, that face to face. And sometimes they can give you some ideas on what food not to eat with your medications, because you want to make sure that sometimes those things, food can even interact with medications. So like if you're on a blood thinner, you're having a lot of green leafy vegetables, that can actually make it worse. So we want to make sure that we're being safe and understand what we're putting into our body. So we're going to talk a little bit more about that, right? We want to make sure we're asking the questions, we're being a advocate for ourselves, right? And talking to our doctors and our pharmacists and all of our healthcare providers about what's going on with us. So whether you've fallen or not, it's still important to let them know, even if you weren't injured, that this has happened, because then they can understand what's happening with you. They can even think about some of these risk factors, right? Maybe you just started falling and you're not really sure why. Maybe it's time to do that osteoporosis screen. Maybe it is time to, check your nutrition and refer you to a dietitian. So this kind of gives them more insight into how they can help you better. So you really want to make sure you're talking with them and being open and honest about what's going on before it becomes a bigger issue. And then then you're requiring more medications and more treatment when it could have really been avoided. Before you go to the doctor, you want to make sure you're making a list. So specifically, if you've had falls, you want to, document everything that happened, even if you're able to get up and go on with your life and there was no injuries, no issues, and if there's anything else too, right? Sometimes you're seeing multiple doctors. Maybe one doctor change your medication, but your current doctor that you're seeing, didn't know, or, just wasn't up to date. Making sure you have all that information available and ready and you understand it, so that way the doctors can help you. I know, how long do you think doctors spent with you?
15 minutes.
15 minutes, right? If you're lucky, right?
Right.
Sometimes they're in and out. Sometimes they're, running in. They have a bunch of things that they're telling you, and you're just like sitting there, and you're like, oh my gosh, like okay, like yes, 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 and you're nodding along. But then when you leave, you're like, wait, what did he say about that? Right? I know that's happened to me, but so it's really helpful if you can have someone with you. Just having an extra set of ears is helpful because they may catch something that you miss, and they may even think of answers that you may not, questions. I'm sorry, that you may not have thought of, and then be able to get those answers for you. Also communication, right? Like I said, be open, be honest. Your doctor is there to help you. And if you feel like you can't be and you don't feel safe with that doctor, it's okay to find a different one. It's okay to find somebody. And I know it's a whole process and it's annoying. But really it's important to have that good relationship so that you can feel free and honest with them. And again, making that list of talking points. What I usually do when I go to the doctor, like I, see them every so often. So I'll make a list of different things that have happened and any questions that I may have. Because like I said, they're in and out. They're on to their next patient. And that's, unfortunately the way our healthcare system is designed. But, we want to make sure that we're getting all those questions answered. So, once I see the doctor, like, okay, anything? And then I'm like, yeah, wait, I have my whole like phone with my whole list there. We go through it together. So I think that's been really helpful for me as well. And just remembering that this is a partnership, right? They're there to help you and they can't help you if they don't know what's going on. So you really want to just be able to be open and honest with them. Any questions so far? Okay, yeah. So I'm going to move on to what if you fall, right? Let's say you did all of those risk factors, you're doing all the right things, but sometimes things happen and it just happens, right? Sometimes it just kind of a fluke type thing. So there's actually a way to fall safely, which I know sounds kind of crazy because in that moment you're in a shock and you don't really even know. I've had patients say like I was just standing and then all of a sudden I was on the floor and I just didn't know what happened, right? But if you can remember anything at all, just remember to protect your head. Your brain and your spinal cord does not heal the same way as bones do. So it's really important that we're protecting our heads at all cost. It's also important to try to stay loose. And I know that, again, that sounds kind of difficult, more, easier said than done. But staying loose, if you get tight, there's more, if I get kind of tight and I'm stiff, there's more likelihood of more impact going on, and that can cause a fracture. So you want to try to stay loose, keep your arms bent. Oftentimes people fall onto their wrist or their hands. They call it a fuchsia, a fall on an outstretched hand. That causes fractures. So, because that force is not being spread out, it's just going straight in there. And so if you can fall, on your elbows or kind of spread out as much as you can, that's going to be the best option if you're able to remember all this. Now, let's say you've fallen, you're, in shock, what just happened? Before you get up, you want to make sure you're taking several deep breaths, right? Staying calm, understanding what just happened, and getting yourself kind of in a good situation where you can think and kind of figure out what to do next. So you want to make sure you're trying to move your arms and legs, right? Making sure that you are not injured, that you're able to move them, you're not seeing any blood around, kind of getting an assessment of that situation. And of course, if you're hurt, hopefully you'll have that cell phone on you like we recommend, or one of those pendants or whatever to call for help. Especially if you're alone. I've had patients say that they've been on the floor for like days. Because they just didn't have a phone near them, or I was just going to the bathroom and I left my phone in the living room, and then I couldn't move after that, right? And so we really don't want that happening. So if you can keep your cell phone or something, or even if you have a device like Alexa or like a Google Home, having those are helpful because then you can just, yell out like, hey, Alexa, can you call 911, right? Or even if some people have Apple Watches, they can also detect if you've had a fall. And then I think it believes it prompts and asks you if you're okay and if you need help. So yeah, there's lots of different tools out there, but making sure that you have something nearby at all times, to make sure that, if you do need anything, that you're able to call for help immediately.
Kana, can we stop there
Yes.
for 1 second?
Sure.
So I used to work in a continued care retirement community, and we used to provide pendants for everyone. And do you know the pop quiz, the average rate of people that actually wore them?
I'm gonna guess it's low, but
I'm
you
gonna
tell me.
guess like 5% out of an
Mm,
entire community. And it was because people didn't want to, I don't want to say vanity, right? That sounds too negative, but they just didn't feel like that fit the aesthetic. So there's also other options. There are the pendants that actually look like a watch. So they're a little bit more discreet if that's important to you. But I just want to stress that because, oh my goodness, so many falls could have been prevented had they just
yeah.
worn the darn pendant.
Yeah. And I don't know, can you put it under your shirt to maybe hide it? I don't know if it still works the same.
Yeah, I mean, people didn't because then it felt a little bit restrictive with their,
Yeah.
I just mentioned that there is an option other than a pendant that is very much like a pendant. So,
Yeah. Yeah, absolutely. Yeah, there's watches. I mean, there's lots of different things available. So yeah, whatever you can do, even if you just have your cell phone with you, that's going to be a helpful method if you don't want to wear the pendant. So if you can't get up, what are you going to do, right? You're going to call 911, hopefully, because you'll have your phone with you. And then you're going to try shouting or banging if you can. I had a patient recently said she was banging on the door for like an hour and a half for her neighbor. She lives alone and her neighbor just, I guess, was out and then they didn't hear her. And so, yeah, she didn't have her phone with her. So that's kind of things that really do happen. And so we want to make sure that we prevent that from happening. You want to get comfortable, right? Because EMS sometimes can take a long time depending where you live. Usually it's about 7 to 10 minutes, but again, if you're out in the rural area or, it's a busy day that they are not able to come quickly, you want to get as comfortable as you can. Use some pillows, keep yourself warm with blankets if it's available, and protect your head, right? So put a pillow or some object if you can, that can keep your head in a good position. And then keep moving, right? Move your ankles, move if you can, if you're not injured. So that way that blood flow is still going, even if you're on even if you're in one position. Now, if you're not hurt, there is a way to get up. So you basically want to get onto one side, onto all fours, and then crawl to a stable chair or a couch or a tub, something that is stable, that you know is not going to move. You're going to approach it from the front and put both hands on the seat. And then if you have a stronger leg, you're going to put that leg up first. And then you're going to keep the other knee on the floor and then rise and twist and sit. So this is kind of a picture here that you can see. She's on the floor here. She's kind of crawling and then puts the hand on the chair and then is able to kind of push through that sturdy object to get up and then kind of twist to sit down. And then obviously after you sit, you want to make sure you give yourself time to kind of rest and breathe and just kind of relax a little bit. Because again, that shock factor is there. And so you want your body to try to relax so that it doesn't get tense and get hurt. If you're helping someone else get up after a fall, if there's a wheelchair or something around, you want to make sure that you get the person onto all fours, kind of the same process, helping them put one hand up and then you would help them from the back. You never want to pull somebody from under from their arms, because that you want to really just support their body. There is something called a gait belt that you can put around the person that can help you have somewhere to hold on to, which is a nice option. But it's really important also if you are trying to help somebody that you're not doing something outside of your comfort level and outside of your strength level, because sometimes we do get those cases where the spouse or somebody or loved one was trying to help the person that had fallen, and then they also get injured, and now we have two patients at the hospital instead of one. So we really want to make sure that we are being cautious, and if we know, listen, I can't get my husband up, he's too tall and too heavy for me, then I'm just going to get him comfortable. I'm going to put him pillows under his head and give him a blanket, and then call 911 so that they can come and do what they do, because again, we don't want people to get injured. And of course, after getting up, you're going to let your doctor know what happened. So regardless, maybe you had a quick fall and then you're like, oh my gosh, what happened? And then you're able to get yourself up and then you felt okay. So you just continued on with your day after resting. If that's fine, you still want to let your doctor know, because again, it could be related to something that, that they're not aware of quite yet. So it's going to be helpful for them to know. Now, let's talk a little bit about concussions. It'll be kind of brief. We want to make sure that if, hopefully you have protected your head and you remembered what I talked about. But if you haven't, then most likely you have a concussion or a TBI, which is a traumatic brain injury. These are the signs and symptoms. How many of these do you think you need to have to be diagnosed with a concussion?
One.
One. Yep, you're exactly right. Just one of these, right? So let's say you had a fall maybe last week, everything's fine, you're managing. All of a sudden you're having a headache or some head pressure, right? No worries, maybe you take some medicine, but it's still there. It's not really getting better. That's when you're like, okay, something's not right. I mean, hopefully you've gotten checked right after your fall, but if you hadn't, right? So this is something maybe that normally you might ignore some of these things or might not think it's a big deal, but it can really be a big deal. Some consequences of concussions can be long-term memory loss, impaired judgment, any sort of concentration difficulty, and even loss of balance, right? So if you're having a more consistent loss of balance, then of course your risk of fall is going to increase. So what should you do, right? So if you hit your head and you fell, you don't remember if you hit your head, you probably did. You want to tell somebody, right? You want to make sure that they are aware, whether it's your loved one, whether you're telling your doctor. And then you want to make sure you're being aware of your symptoms, you're not hiding them. Sometimes it's helpful to tell somebody so they can help monitor your symptoms too. And maybe they may notice some things that you don't notice. And that can be helpful as well. And what they usually recommend for concussions is to rest your brain. So that means no any sort of stimuli. So no lights, no TV, no radio, like you're not doing anything. And that can get really uncomfortable and boring. And so we want to make sure that we are avoiding that at all costs if we can. So, in conclusion, we have learned that falls are not a natural part of aging, right? There are so many things you can do to help prevent falls. You can work on your nutrition, your vision, exercising, making sure that you understand your medications and the risks that you have from that. And then working on your fear of falling, right? Trying those things and making sure that everything that you can do to help yourself, you're doing so that that fear is not leading your life. And then, of course, you want to talk to your physicians about falls if you're concerned, maybe if you're not sure about if you have osteoporosis, asking about those things and saying, hey, do I need a screen? Like, can we test my bone density? Particularly if you're a woman after menopause. It's important to have that information so that okay, I need to make sure I get enough calcium and enough vitamin D. And then we do have handouts that we give out in our in-person classes. So if anyone's interested, you can email me and ask for them, and I can always send you over like a PDF version if you're interested. There are some resources also that are available, and there's way more than this, but there is 211, so you can call 211 and just ask them for whatever it may need. Maybe you need some nutrition help. Maybe you need some help installing, handrails. They can kind of guide you and let you know what to, where to go for that information. The Department of Aging and each county has their own services that they offer, like I mentioned. They even offer a free senior call check. So if you're someone that lives alone or is alone often, you can register for free, and basically they call you to check in, make sure you're okay. If they don't hear from you, then they will contact whoever you deem as your emergency contact so that they know that, you haven't responded, and then they can, take action from there. There's also these smartphone apps, Snug Safety and Life 360. So again, if you live alone or if if your family is not living near you, they can kind of keep an eye to make sure, for me, my parents live in New York City. I can check and see, hey, my parents have a doctor's appointment today. Let me make sure that they can, that they got there safely. And there's also all sorts of classes. I thought it was interesting that they had like computer and phone classes as well. So if that's something you're not sure of and want to work on, there's all sorts of things. Of course, there's legal help and other things that you may need, in the future. So lots of things out there that can be helpful. And then we do have a post-class survey, but if there's any questions, I'm happy to answer them. And we're always open to feedback. So if you don't have your phone and you have any sort of feedback, you're welcome to email us at prevention.edu.
Kina, I've been to many fall prevention seminars in my life, and I like to think that I learned a few new things from this one. So I hope you all feel the same as well, at least one or two new nuggets. So thank you.
Yeah.
Thank you, Kina.
Absolutely, my pleasure.
Yeah. Any other words from the participants? Because I want to make sure we give enough space and time.
And I can put my email in the chat. So if anyone wants any sort of resources or needs anything, then I'm happy to send it over.
Yeah, there's one question I had in regards to the resting your brain from concussion. Was listening to music is that acceptable, or is that also considered stimuli?
It's usually considered stimuli as well. It also depends on what happened, because sometimes on imaging they can't always tell that you've had a concussion either. So it's not like, okay, I'm cleared because I didn't see anything on imaging. So it's important just to rest your brain fully, and your doctor will guide you on what that looks like, because it can vary, but generally it means no stimuli at all. Yeah.
And that actually includes conversation as someone who've had a concussion before, because
Yeah.
so much of our communication is nonverbal and your brain is processing that. So, oh, as from a big extrovert, that was tough for me.
Yeah,
Well, that,
it's really not something that's fun. You're just kind of sitting, doing
right.
nothing in a dark room, and it's just, yeah, not exciting. So we want to avoid that at all costs if you can.
Thank you very much for your answer.
And oftentimes we see people, they might have had a concussion and they go on and then it happens again and again and again. And then that's when you get more of those consequences, the long-term consequences. So it's really important to, even if you're not even sure, but you hit your head or you fell and you're not sure if you hit your head, it's still important to let your doctors know so that they can kind of monitor and see what's going on. Yeah.
Well, thank you again, Kana. We really appreciate it. And Lauren, thank you also for
Thanks.
joining us. Um,
Uh,
have a great day, and thank you for this presentation today.
yeah, thank you all for coming. And hopefully we'll see you all soon.
Thank you.
Bye-bye.
Bye.